My name is Kevin Manjal. I'm an emergency medicine physician at Mount Sinai, and I have a subspecialty in EMS. EMS, there's a lot of abbreviations going around that went over my head today, so just to make sure we're on the same page, EMS means ambulance services. So I've worked with the New York City Fire Department, and I currently administer some of the EMS units out of Mount Sinai. This organization is called Trek Medics International, and the connection is that we have this sophisticated EMS system that's quite expensive to run. We have a fantastic, I don't know if you've ever been there, after 9/11, which we'll talk about, they spent lots and lots of money building out an even more expensive and grander version of a 911 system, fancy monitors, etc. Well, the developing world doesn't really have all that. What our product is, we're going to talk to you a little bit more about, is actually a solution for a developing nation to actually implement their own system that would replace 911. So we really appreciate the opportunity to come and speak to all of you today. I know this is a little bit outside the normal kind of discussion, but if anyone's going to appreciate bringing technology to the developing world to sort of leapfrog over, I think this is the audience for it. So I already kind of covered most of my intro, but I will just take you back for one moment to September 11th. A lot of you probably remember where you were on that day. It was memorable for everyone. As an emergency medicine physician, I go through this every September 11th. We go through lectures, we discuss all the lessons learned, all the things that failed, and it always comes down to communications. Not only was what you may have heard about the radios, the agencies couldn't talk to each other, but 911 got overwhelmed here in New York City. On that day, we realized that 911 is something we take for granted. And it's the fundamental social and healthcare safety net. And unfortunately, lots of places around the world that don't have it. Even today, you can see that sometimes it goes down and we're resorting to pen and paper. That expensive system can exist in the third world, and I think that we have an exciting solution for that. So I'll turn it over to Aaron.
Thank you, Kevin. Yes, my name is Aaron. I'm Communications Director at Trek Medics. And as I served in the Peace Corps in Morocco, I saw that not everybody is as privileged as we are to have something like the 911 system we have. You've all, or most of you, have probably been to a developing country. And think about, put yourself in this situation. What would happen? A bicycle accident, you had a heart attack. Literally, who would you have called? Do you know? Because that is how a lot of people just live their day-to-day lives. And when the worst happens, there's not always a lot of solutions. Sometimes it's just call a taxi, flag down a truck, and that's the best there is. So picture it. Heart attack, problem childbirth. You call a taxi. Well, he doesn't answer. You call another taxi. He's busy. So no matter what condition you're in, you may find yourself waiting at the side of the road for the next passing motorist. And that's all you've got. So what's the solution? Beacon. That's what we're calling it. That's what it is. That's going to be how we coordinate what's already available. A lot of organizations are happy to throw ambulances and perhaps some money at a problem. But the thing is, what we really need to do is do what's sustainable, and that is improve what already exists. They have training, they have transportation, and that transportation may not be the conventional ambulance like we picture it. Sometimes the road conditions, the finances of a municipality, you can't support that sort of thing. So this is the sort of ambulance you might be looking at. And certainly they have communications. We know here that cell phones are becoming ubiquitous in the developing world. So what's missing is the link between all of them, the efficiency. And that's what Beacon solves. With a simple cell phone and a simple laptop, we can run this procedure, which is how an emergency call runs anywhere in the world, whether it's myself as an EMT running a call in New York, or a taxi driver running a call in, say, Morocco or Haiti. And what happens is, of course, there's an accident. A response a call goes out, and the first responder responds to that. He may or may not request additional resources, transports a patient to the hospital, hands over, and he's back in service for the next one. How does it work with Beacon? You see an accident, a text message goes out from a victim or a witness to the server. It looks like this. This is what the taxi driver, the truck driver who has logged into the system that morning. He sends a simple text message. He's logged in. Now he's available to get all these messages. So this is the location of the incident. Can he respond? And he answers 1 for yes, and 7 minutes is his response time. Next. The server has decided that 7 minutes is the closest time. Perhaps another person answered 10 minutes, 12 minutes. 7 was the best. He gets assigned to the job. And once he's arrived on scene, he keeps everybody in the loop. The information flow continues. He answers yes, 1, I'm on scene. The server then tells him 2 people are behind him. 2 first responders with 2 vehicles are coming to assist him. Does he need anything else? Perhaps he just showed up on a bicycle. Perhaps he does need a vehicle, but in this case, no, he doesn't. So he answers 0. And then, once he's collected his patient and he's rolling, he confirms that he's transporting, in this case, 1 patient. Yes for 1 patient, and then he'll be there in 12 minutes. He gives his ETA so that the hospital staff is included in the loop of information as well. Next, he arrives at the hospital. Next, he decides, once he's confirmed that he's on his way, the system asks him, let us know when you're finished with the call. But in this case, you see he types number 3. There's a delay. He hits some traffic, so he estimates another 5 minutes. The server knows this, and the hospital staff now knows this. It asks again, confirm your arrival. Now he's finally arrived, so he types a 1. It says, okay, thank you very much. Are you back in service? Can you take another call? He types a simple 1, yes, and then he's given his response times. Now this data can be used for training, efficiency, World Health Organization, all the people that need health data, well, now that's available as well. So that's the basics of how a call could run in a place where this sort of thing is just not simply available. To give you a good look under the hood of all this, Mike Rive, one of our best developers, will take it away.
Hey guys, it's good to see you all again. Essentially what we put forth to you is an emergency dispatch system that's automated, that responds to text messages, stores data in real time, and can allocate resources for assistance. It doesn't require internet to operate, and it can operate on most commodity software available. The software interfaces through Frontline SMS or other web tools with a regular modem just like this one that we use in Haiti. It costs about $30, and any phone number tied to this can be a 911 service for the community. On the administrative end, you have a graphical dashboard that any user can input phone numbers, they can see log data already, and there's even there's a translator that can translate the dashboard and outgoing text messages individually. So in Haiti, you could have the dashboard in French, while all outgoing text messages could be in Creole. Now, with cell phone penetration at over 80% in most of the developing world, when our team went to Haiti, we had everything we needed. We brought our modem, we brought our laptop, and all first responders undoubtedly had cell phones. We were able to teach these first responders the software in 2 hours, and they were actually able to teach their peers the software in less than half that time. That being said, the IT requirements for this to maintain this project is relatively minimal, as we only need 1 person that's pretty well versed in the kinks of the software, because once we set it up, it's relatively linear in its form. Now, other than me working with the software, we have our tech director in front of us, Mike Samuels. We also have Evan Wilder, who's a grant writer with us today, and Aaron Schemmer, who is our risk management. We also have a video that we want to show you that better illustrates our concept, and I hope that paints a better picture.
sure Beacon is a clever idea. We hope you agree. But to people who don't have 911, this is a tangible product that fulfills a veritable need. This is a chance for communities, large and small, across the world, to establish their own 911 system where none was feasible before for either financial or technological reasons. Now, a lot of communities around the world have reached out to us, and we're currently in the process of raising $75,000 to establish 3 pilot programs: Haiti, Costa Rica, and Rwanda. We're looking for your support and your blessings. We're excited about making it to the next phase to get this software in the field. And can I get back to the slides? No, never mind. Okay. Again, thank you. That's where we're headed. If there are any questions, that's what I was going to say. You can say no to us, but don't say no to him. This is one of our from our first trial test, our emergency responders down in Haiti. So if there are any questions, please let us have it.
How does it work in terms of actual real-time adoption? So let's say there's an emergency and someone's driving over and they're trying to get there as quickly as possible and responding. I mean, do they really have time to text? So they're on the road, we're going to the hospital. I mean, are you driving and texting at the same time?
No, certainly hope not. No, there's sort of, in any emergency call, there are action points. And communication is also very important. Even in this country, certain things have to be communicated. And emergency calls are, this may frighten you to actually learn, but they're not necessarily as frenzied. That is to say, they teach us as EMTs, and I'm sure emergency docs as well, that sort of taking things in a stepwise process and considering your next move. For example, you won't see EMTs running. It's just not, it's part of the process. And this communication is very important, especially to let the hospital staff know at what phase of the game things are, to let the other emergency responders know where things are in the process. There ought to be enough time to Ernst.
May I please add, Michaela? The idea is that it's a simple coded text. The priority is the patient to get the accident clear and get people to where help is. So therefore, there's no time for large texting. It's just one single digit, no confusion, fast, so that they go to work and help the patients.
Yes, sir.
Are the governments not willing to fund these?
A lot of governments aren't able to, but we're working on a variety of funding sources, including grants, and also, for example, in Haiti is a case for a great deal of aid, and that's the sort of thing where we need the attention. We need, if anybody has any connections to telecom companies and government agencies, Haiti is a place that is the recipient, for example, of a lot of aid, whether it's USAID, Bill Clinton, Bill Gates, and all these sort of things. So, unfortunately, we're looking for the publicity and the strong testing results to move to the next phase, in addition to the funding, whether that be directly from governments or perhaps our own government. Sir, do you have one as well?
So, who makes the first call? And when you go into a country, do you have to have an advertising campaign that says, hey, here's a number now. When you drive by an accident,
that's actually
let us know.
A lot easier than it may seem. When I was in Morocco, I got at least one text per day during some periods from the telecom company telling me, reminding me to essentially support my local sheriff, or that they were running some sort of new game, new raffle, new prize, that, don't forget to vote, don't forget to do this. The billboard is in their hands all the time. So for an entire week straight, you can get a message of, hey, anything goes wrong, text this number.
And so if I'm a citizen, I have to learn that number. So when I drive by an accident, I need to learn the text structure? Or how do I...
It would
I call in and there's an operator?
To the user, you text that you need help, and it asks you specifically.
Oh, if I am the one who has the accident
the victim,
and can still text.
Right. You're only training the responders. We train a few responders. It takes 2 hours, and it seems to be very efficient, a very short learning curve, and the users have a very easy interface. Especially the initial is simply, they can say whatever they want, and that gets transmitted in exact string text to the responders.
Mm-hmm.
Is that like a self-contained for that particular community, or is that somehow tied back to your
These are all designed for individual catchment areas. We do have 2 models, one for a centralized server. Let's say if we're dealing with an urban area, we have multiple instances of Beacon in those districts that go to a centralized server. In more rural areas, it's really what is stored locally on the laptop that can be transferred otherwise.
Okay. And that, I mean, that's my question. If that is the case and you have the software, then is that the funding that you guys are looking for those 3 different regions? Or what exactly? Because you asked for, like, you wanted to pilot in 3 different locations. What is exactly?
Well, the money would include the software optimization as well as the travel for the trainers, and the trainers would be people who instruct upon the software as well as some emergency response skills for the drivers in question. One more thing, all right?
Mohammed may just quickly expand. The idea is to enable the local community. Think of a marketplace of about 100,000 people. Where do we find volunteers that get medical training so they are actually well-versed, literate first responders, so they can go on site and then decide how help is best reached? The community obviously learns that this service is available. Monetization schemes are obviously, we have estimates how many text messages will be triggered over like a 12-month period in catchment areas, but that's dependent on what are the local telecom carriers' possibilities. Ideally, you would think the government would help to come along, but they're rather interested in how can you help us fund our healthcare budget for our nation. We can obviously help medical training. There's an education, sort of an employment type of benefit. There's all sorts of good things that can happen around it. Key is that this is simple and scalable.
Absolutely. Thank you.